If you don't have your health, what do you have?
You are a functional medicine doctor.
Join us as we blend modern and ancient wisdoms to be well now.
So we're talking about 5 herbs at home in my cabinet somewhere.
Yeah, this is something that you can pull off your shelf and you can improve your physiology, reduce your dependence on medication, and be well now.
Well, let's talk about bio-enhancers.
Let's do it.
Dr. Ron Dummar, I'm excited about this. I'm all about being well. That's, as your patient, why I propose this podcast. And you want to help people meet them where they're at. So talk about these bio-enhancers.
Yeah, well, herbal bioenhancers are herbs, plants that actually improve physiology, or they work on other substances that you might already be using. They enhance the ability of those substances to influence your physiology. So let's say you might be taking a medication for cholesterol. Well, if you're using a bioenhancer, a food, it would actually improve the effectiveness of that drug to have an impact on your physiology, therefore reducing your dependence or reducing the amount that you need to take of that medication.
So obviously this is something where people want to chat with their individual practitioner and customize, but can you just give us one of these that is at home, how it works, how we can incorporate it in our diet?
Yeah, so there's a couple of different pathways or reasons that these work. Some of them are digestives. They help with certain physiological functions in the body, but they either help with clearing debris or preventing debris from being cleared out of the cell, or preventing certain pathways or enzymes from clearing toxins as quickly. Okay, and so one of the things that you would want to include, or that you could include, is something that's super popular right now. Everybody's talking about it and likely taking it already, and that is turmeric. Turmeric is actually a bioenhancer. It's also anti-inflammatory. It's huge on the scene right now in the health world as an anti-inflammatory, but it is also a bioenhancer. So there's certain medications like antibiotic or immunosuppressant, cyclosporin is one. It's an immunosuppressant, and it's used with patients who have immune issues. Okay. Now you can imagine what's the function and role of the immune system. The immune system typically initiates inflammation. Well, what's turmeric's role? It's anti-inflammatory. So you can see how it can be a very cogent bioenhancer for immunosuppressant or an anti-inflammatory medication. How
should I take turmeric? Because I know you could get the root, and then there's all these supplements, and what's the most efficacious way to get it working for me?
Yeah, so I like to put turmeric in a blend of other herbals when we use it in our practice, because turmeric actually can be quite drying. I would almost think of turmeric like ibuprofen. So ibuprofen or some of these anti-inflammatories, they're designed to clear the fluid or clear the inflammation. So as a result, they can also be a little drying, right? Because they're getting rid of fluid. So turmeric also has a tendency to be a little more cloying because it's drying up, and even to reduce certain amount of fluid, which then can make tendons or ligaments more brittle. Turmeric doesn't do that as significantly or severely as something like ibuprofen, okay, or a corticosteroid, which can cause a lot of ligament or tendon drying or brittleness down the road. But it certainly does dry or reduce the level of inflammation in the body.
So how would you recommend I take it?
Oh, thank you. So what I would say to do to take it is you can take a tablet. In our office, we use it as a tea, and we mix it with other herbals that support it. So we reduce the likelihood that it's just going to have a singular effect in the body on the drying, and we help moisten the body and the ligaments and tendons as well while we're having that anti-inflammatory effect.
What's the tea?
So the tea that we use is a pain-relieving tea. We have a variety of different herbals. There's a focused anti-inflammatory for the lower body, and there's anti-inflammatory focused for the upper body as well.
So if folks are curious about those, how do they get a hold of you?
So you can call into the office, or you can even text our number at 435-657-3696, and you can ask about the specific anti-inflammatory teas and turmeric-specific focused teas for anti-inflammatory.
Okay, what else?
Another one is black pepper. Black pepper is traditionally used as a digestive. Okay, and and I say a digestive. People think of pepper as being warming, hot. Well, it is. It's a warming substance, and it is hot, but it actually functions as a digestive. It helps the body breaking foods down, and some of that heat and metabolic activity that it carries allows it to provide that effect. Now, that black pepper works through an enzyme called the P450, cytochrome P450 enzyme. This is like a detoxification elimination enzyme. And so any medication that might have an effect or might be cleared through that enzyme-dependent pathway would become more effective or would be affected by the use of black pepper.
So
and these
just
would
put
be
it in my
things,
food, or take it
even just putting
specifically
in
as a
your
supplement?
food. But you would need to take much higher dose of black pepper to have the significant therapeutic effect to be bringing it in context to where it has a significant impact on the medication with your physiology.
So are there supplements you recommend?
So there are supplements that contain black pepper. In fact, one like turmeric is often paired. You'll see in supplements, if you look at your supplements, it's often paired with black pepper. And that's one of the reasons for that is that it can help your body digest it and absorb it. So the medications that I wanted to tell you that you might be taking that could, let's say, could be enhanced or could be improved by taking black pepper are most of your antibiotics. So antibiotic activity can actually be improved by taking black pepper during that process. So if you're placed on an antibiotic, either its ability improves significantly in your body or your need to take as much reduces.
And that would be okay to take with turmeric if that's what you've got, or?
Well, yes, but we would be looking for higher amounts of black pepper. But I would say even just be including that in your food. Lots of black pepper in your food and everything that you do. Even if you have a salad, put black pepper on it.
Because I've seen like Carnivore MD, Paul Saladino say like you should never use pepper, right? There's very like dogmatic camps. You're saying black peppercorn is good.
It's beneficial. I'm saying it has an effect on the cytochrome P450 pathway, which could actually bio-enhance the use of antibiotics.
Okay. Very good. Next.
You want to try ginger? Should we talk
Sure.
about ginger? A lot of people use ginger.
Real
right?
ginger or supplement?
Real ginger.
Okay.
I would say use the fresh ginger. Grate the ginger, put it on your food, put it in a tea, steep it, mix it with mint, mix it with honey, lemon. A lot of people like to have that type of a tea. But ginger has gingerols in it. It's one of the major active ingredients. It's very anti-inflammatory, very strong acting on the stomach. And it functions as well through the cytochrome P450 pathway, which is, again, the elimination pathway. But there's another one, which is the glucuronol transferase pathway that it works through. And that's more at the cell level as far as clearing things directly out of the cell. So ginger can help influence those pathways. Okay, and the medications that you would be looking at, okay, what medications might I be on that could be benefited by the use of ginger? And again, just to put this out there, and we mentioned this at the beginning, but if you're on any of these medications and you're thinking, okay, I'm going to really increase my use of this food or herb in my diet, you should make sure you notify your practitioner before you start doing so. Because they need to be on board and they need to understand that these numbers might be coming down and you might be having other symptoms that would require them to be more focused in managing your condition in the shorter term. Okay, so gingerol works on propranolol. Now, propranolol is for tachycardia or increased heart rate. It's also been used for anxiety and things like that. Also midazolam or anti-anxiety type of medications in general. And then also NSAIDs like ibuprofen. So ginger, taking more ginger can actually reduce the need that you have for taking ibuprofen.
Doesn't reduce the pain, but it reduces the need.
It will reduce your pain as well. So the gingerols are anti-inflammatory. So your NSAID, which is your ibuprofen, is a non-steroidal anti-inflammatory drug. It also has been shown to cause a lot of stomach-related issues. Gingerols are beneficial for the stomach, are anti-inflammatory, and they'll reduce your pain.
So how should I take it? You said a tea?
So I like to do it, my ginger, with a tea. That's how I like to do it.
In the evening or
you
anytime?
can shave ginger. You can put it in your food if you're cooking. Just add it in a lot of different ways to your food. There are ginger capsules. You can get full-on ginger capsules and 500 milligrams of ginger you can be taking. I prefer to put about a thumb size of ginger. I scrape it off grate it off, thank you, into the water. And then I steep that essentially with some lemon, some honey.
And that's something you do if you were taking a lot of ibuprofen and you wanted to supplement?
If you were wanting to reduce your dependence on any of those medications, yes.
Okay. Very cool. I'm listening. And it's interesting when you're actually on these, right? And so for me, it's if one of these hit home, I would probably be like, whoa, oh my gosh, tell me more. But I'm always curious how to apply this in the real world. And before we talked, it was just like, make sure you have that conversation with your doctor.
Absolutely.
Yeah.
Absolutely. So one of the next ones as well.
And what happens if they tell you none of this actually affects it and you should just keep taking the prescription they have for you?
Then take more. Then just enjoy yourself. Just keep going after it. Yeah.
Okay.
What you should do is you should have a consult. If you want to really increase the dosing, I'm talking about you implementing these really into your life, implementing them into your diet. Okay, this is diet and lifestyle wellness now, hoping to have an impact on physiology over the long term. This is the long game that I play.
It's like planting seeds in a type of garden where you're like, I don't know if this tree is gonna like blossom in 5 years, but like the long game is very nuanced and it's not a day trading.
Absolutely.
Everything is like now, right? How you feel is now, and you want to feel better now. We want to be well now, but
the long game is important.
Yes,
and the long game is dependent on what?
What you're doing right now.
Right now.
What a paradox.
Yeah. So it's like the long game is important. It's even more important what we do now for our long game than it is now, right? Like what we do now actually may not really impact us as much right now. But in the long game, it impacts us dramatically.
And that will be our now.
Yes.
What a weird game to play.
Mm-hmm.
Hard to explain that to my kid. I was trying to do that yesterday and get him to drink some tea, and I said, it's not always going to make it better right now.
Exactly.
That's a tough sell.
But it's working, and the progress is setting the seeds, planting the garden, working with the environment and the terrain. That's the really important piece, because if you have a solid terrain, if you have a solid environment, a lot of people understand it environmentally. If your environment is clean, then there's a lot of benefits from that. If your environment is, you have dirty, polluted water, you have factories that are dumping into your streams and your ponds, you have them, gassing off into the air, and it's hard to breathe. A lot of people actually call from the larger cities near here as well. And they're like, what's the weather like or the air quality like in Heber? Should I move up there? And they're asking us those things all the time. It's because environmental terrain matters. It matters to us.
Yep.
And so what about the environment and the terrain of our body? That's what we're talking about. We want you to set the terrain for your body so that we're not dumping chemicals, we're not dumping things into it that are going to be setting the stage for problems in the future. But we want you to be well now and be well in the future.
Yeah, I don't know why I have this idea of like mixing all these metaphors of weaving something in just like this giant DNA strand type fiber rainbow cornucopia something. But like what we're suggesting now with these bioenhancers, I feel like it's just a thread.
Yes.
But it matters.
Oh, it matters.
Yeah.
Well, it matters so much that when you get
maybe it's more than a thread. I don't know.
When you look at even the field of epigenetics, we've studied a lot of epigenetics, and this wasn't necessarily a planned part of our discussion today, but they've studied that the diet that the mother of the fetus consumes influences what diseases that fetus or that baby will get, even into their adulthood.
While the baby is in utero or before?
While the baby's in utero. So what the mom consumes, what the mother consumes, the diet of the mother is critical. And actually the diet of the father is critical too. But we know for certain with epigenetics research that a mother consumes higher amount of methylation factors, which essentially is like organic compounds, naturally occurring compounds that come out of the earth, a carbon attached to hydrogen. Okay, that's a methyl factor. So mothers who consume higher amounts of natural organic food, they eat real food of the earth, hand off to their children, their offspring, a greater lifespan of health and wellness. Period.
Not surprised.
Yeah, so we're wanting to draw you to consume as many natural and organic methylation factors type compounds as possible so that all of our systems and physiology in the body are working properly. So that when we're introduced to a medication, if we have to be or need to be, it works and works really well. It's efficient. It's effective. We get in and we get out. It does what it needs to do in our physiology and we get out. That's why we would want to be using a bioenhancer.
Makes sense to me.
Use bioenhancers so you have less dependence on medication, period.
Ginseng.
Ginseng is our next one. Bioenhancer. It's a great bioenhancer. And ginseng actually works through a pathway called the P-glycoprotein pathway.
Okay.
And ginsenosides is the active ingredient typically within. It's the major active ingredient in ginseng. Okay. And these ginsenosides have been proven to affect our health and our well-being and to provide like an antioxidant and anti-inflammatory effect in the body. People often think of ginseng as energy, as almost a panacea of anything that's good and to keep you amped and hyped, right? They want more energy, they want stamina, they want to perform, they'll go to ginseng. Ginseng actually, ginseng will interact with certain medication or enhance the bioavailability of certain medications that influence heart arrhythmias. Medications used for heart failure like digoxin, and then also medication used for HIV like idinavir. Okay, so it can impact the effectiveness of that medication, enhance the effectiveness of that medication. And we mentioned one already, an immunosuppressant, cyclosporin. It works on that as well. It can enhance that through this P-glycoprotein pathway. All right? The last one. Should we talk about the last one? We're getting close.
Yeah, garlic.
All right? Garlic. Now, who would think? Garlic, right? There's garlic. We throw garlic in so many different foods. We have it in meals, and it's a flavor enhancer. We use it in so many different ways. Allicin is one of the major active ingredients within garlic. It's actually antibiotic. And you can smash it. If you smash garlic and you leave it for 20 minutes and then use it, you actually get a lot more of that allicin development out. So smashing garlic, letting it sit for a bit, and then using it has been shown to be more beneficial for our bodies, especially for getting that allicin out. But what medications that you may be taking could garlic influence? Well, we know for one, garlic is a blood thinner. Tends to help the blood product. So if you're on a blood thinning medication, right, is it going to enhance that? Absolutely. So there's a possibility that you might want to talk to your doctor and say, hey, is it possible for me to take less of this if I'm taking, if I'm taking garlic on a regular rate? But the doctor also might say, no, just don't eat garlic. And that's something you need to consider, because that's the care provider that you've chosen. And if they say, hey, I don't want you to eat garlic, well, you either need to don't eat garlic or find a different care provider. Those are kind of your options.
The more I do this with you and learn about what you do and all the patients you talk to, and it's all so individual. Like it
is 100%.
My full-time gig is day trading in social media content and have a whole content creation campaign around that. And so I'm very aware of like how to get people's attention. And I do it from a good place, but it's like I'm trying to give them something snackable to like chomp into and eat, and not to mix metaphors, but when it comes to human physiology, like every human being metabolically and emotionally and past experiences and lifestyle is so different. And I just crave a one-size-fits-all answer for you so I can package it in this podcast, but I know how nuanced it all gets. And we can give people information in a really engaging way, but like health is wild.
Yeah, health is individualized.
The more you tell me about it.
Health is individualized. And at some point we're going to turn the tide on learning that, because health has been packaged as a McDonald's meal. It's a Happy Meal, right? And we haven't been very happy with it, unfortunately. And if you look around, our country is sick, and our nation is sick, and we're one of the sickest nations on earth, actually. And so our implementation of the business model into healthcare has not been the greatest marriage. And so we need to find other options for that, because healthcare is individual. How do you get the benefit out of personalized, individualized medicine? How can we deliver that as a community, as a government, as a nation, to as many people as possible? And how can we do that effectively and efficiently? And we'll be talking about some strategies coming up too that can provide options for people in certain critical areas of their life for pennies on the dollar. So the options are out there. The possibility is there. The question is whether or not we want to create the structure and the framework around it to support that. And there may just not be enough dollars and cents for certain people to be involved. And that's okay. Maybe they just get out of it.
Maybe certain people will hear this and make decisions, and that's what we can do now. And maybe that's too humble of an approach, but can't change the whole world. Although maybe we can, and that's a different discussion. Garlic, I'm looking at your list here.
Yeah, so garlic, we utilize garlic. It will improve or bioenhance HIV-type medications. So if you're taking HIV or AIDS-type medications, Sequinavir or ritonavir, this will enhance the ability of those medications to affect your physiology. Garlic. Something as simple as garlic. And it works, I think we mentioned it works on the cytochrome P450. Did we mention that? Maybe I went out of order on that one. I apologize for people. But it works through the cytochrome P450 and pathway. We've mentioned that several times. And also, Nick, just to give people a taste of what's coming on this topic, there are at least 10 more of these herbal bioenhancers that I'd like to share in the future. So if we get a good following and we hear good feedback, then maybe we'll do this again and do 5 more, right?
Okay.
But if not, if we don't have good feedback, then people say, you know what, we don't want to hear any more about Dummar's weird stuff, fetishes with his herbs.
Give me a pill.
Just give us a pill.
We get it. You have plants are the best medicine shirt.
Yeah, there you go, baby.
God's green earth and everything that it helps provide in health. And
just give us 5 tips. That's all we want every session. That's fine. We're good with that too, and it'll be fun. But
no, it's interesting though. I've heard of all these, and there's supplements galore.
Most people have these on their shelf at home.
Absolutely.
Right?
And if I was taking any of these medications, I would talk to my doctor about it. Like, can I supplement with this?
Mm-hmm.
Like even getting off an antidepressant, here at your office, I got 5-HTP. And not until I brought it up to my practitioner, like, hey, like getting off these things is really wild. But I've been taking 5-HTP, and they were like, oh, well, if you're taking that, then that should be helpful. Yes. And I was like, you know about 5-HTP, but you're a traditional clinic. Never did you bring up any natural ways to help me outside of these pills. But they were open to me wanting to get off them. This was a long time,
which is great,
prescription that I'd had that I am now off, and I was in the process of getting off of them. But I mentioned 5-HTP, and they were like, oh yeah, I know about that. And yeah, if you're taking that, that'd be really helpful for you. That should be good. It's like, well, why don't we have this discussion on the front end, right? So anyway, the more that you at home know, the more you can bring up to your professional, and you're like a coach, but like you want your player to care more about it and take you can't do everything for your players, right? As a coach.
No, well, if you can teach somebody to fish rather than fishing for them, and that's been my objective from the beginning, is if I can teach people what to be concerned about, what matters in their health. We often focus on very specific things like our shape, our body size, our weight, right? We focus on those things a lot. And yet those things are only symptoms, right, of health. They're only displays of several things upstream that we need to correct. And once we correct those things upstream, then you'll see those issues resolve as well. And so what we want to do is help people go upstream, help them learn what foods, what bioenhancers can help benefit their physiology, maximize their physiology and their overall health, that they can start implementing those things in their life so that they can reduce their dependence on synthetic medication.
And if they're hearing this, they lasted this long, they're probably really engaged in this topic. They could probably reach out to your office, explore getting their blood panel and figuring out what's going on and getting a personalized approach from you. Is that where you recommend they start, or would you just say?
I would have them reach out and we'll sit down and we can do a consult. And if you're not here locally, we can do a virtual consult and we can discuss what would be the best route for you, whether that's labs or treatment in a facility near you of some sort. But we can definitely get you headed on the path to health and wellness and point you in the right direction, give you the information that you need to begin fishing and catching those fish on your own.
And one fish will not feed you for a day. And even if you know how to fish, you're going to have to keep doing it. Maybe there's better systems around that metaphor and a giant ship with big nets. But I don't know. I'm just saying you got to show up every day, don't you?
Absolutely.
You keep putting in the work.
There's never an
consistency.
End. Consistency is the key. And again, if you're looking at where do I want my health to be, it's a level of consistency to that desire and to that feeling, to that idea that you have of where you want your health to be, that you have to stay committed to over a period of time until you realize pretty soon you're there. And then once you're there, you go, oh, there's actually a higher level of health I can achieve now. And do I want that, or do I want to just stay here? And you can achieve higher and higher levels of health. You can go as deep or as high as you want into it. And the sky's the limit. And it's literally like coaching, you mentioned earlier, coaching athletes. When I coach youth athletes, I'm looking to inspire them about their level of play and their interest in the game. And I want them to buy into the skill sets that I'm teaching them. And if they go home and train and practice on their own, those kids go way up. They advance so much faster in their development, which in the analogy here, they would get so much healthier. They would reach their goals so much faster. Because why? Well, because they're putting their time in every day. That's it. And you can tell. You can tell which kids are putting their time in and which aren't.
That makes sense. Well, we thank you for your time today.
Thank you for listening in
on the Be Well Now podcast.
Namaste.
Namaste.